Hello everyone, my name is Dr. Igor Atabekov. I am clinical oncologist practicing since 2010 in Russia. Today we are exploring a chemical chameleon of medicine, dimethyl sulfoxide or DMSO. Historically, it has been pigeonholed as two things: an industrial and pharmaceutical solvent and cryoprotectant needed to protect the cells during freezing, so they're not damaged. But modern science reveals a far more complex picture. DMSO is emerging as a multifunctional agent with three evidence-based roles. Today we will explore the substance as the powerful drug delivery vehicle, then a bidirectional immune modulator, and the differentiation inducing agent in cancer therapy. So let's start our conversation. This is the screenshot from their well-known journal, and it shows us their randomized trial of topical ascorbic acid. It's a type of vitamin C dissolved in DMSO, and it was compared to imiquimod. This is the well-known cream for treatment of local skin cancer lesions like basal cell carcinoma. What does imiquimod do? It attracts immunity to attack this cancer, and this is the famous and official treatment for many superficial and small skin basal cell cancers. So, first role, the supreme delivery vehicle, and it's proven in clinical practice. This is the most established and practical application. DMSO is has unique chemical structure, and it allows it to carry other drugs into their tissues. Let them get deeper. The 2022 basal cell carcinoma trial tested 30% vitamin C ascorbic acid in 95% DMSO versus, again, standard imiquimod cream for skin cancer. The result, that DMSO delivered vitamin C solution was more effective than it was almost 90% effective for clearance of these cancers, and caused far fewer side effects than the standard treatment. Critically, it left no hyperpigmented scars, meaning that the area where the cancer will be less pigmented, less colorful than the other skin, so it will be whiter. Of course, it's a cosmetic defect. Here, DMSO was considered to be not the drug, but it was the enabling technology. It made a high concentration of vitamin C deliverable, effective, and cosmetically superior to standard treatment. And as we know, high concentrations of vitamin C become not antioxidant but pro-oxidant. I covered it in the lectures on vitamin C intravenous therapy for cancers to help fight cancers. By the way, there are a lot of clinical trials on this nowadays, especially resistant cancers like, for example, pancreatic cancer or different cancers with KRAS mutations, for example. Second, as I told you already, DMSO is the immunomodulator, and this is where it gets fascinating. It doesn't just suppress the immunity, it fine-tunes it based on concentration. At low concentrations, less than 2%, it acts as the mild immune stimulant or irritant. They found out that it increases the release of histamine. It's an allergic but also protective substance of inflammation. And as we know, acute inflammation is the body's protective mechanism. And this might be harnessed to boost certain immune therapies. But at high concentrations, more than 2%, it acts as the potent anti-inflammatory and immune suppressor. It blocks key inflammation pathway like NF-kappa B, and this is the basis of its FDA approval for interstitial cystitis, inflammation in the bladder. There is an interesting discovery that high-dose DMSO can reprogram naive immune cells into the regulatory T cells. In easy words, these cells are body's peacemakers that calm down immunity or allergies or autoimmune attacks, like people who have autoimmune conditions. And this is the basis for preclinical research for example, diabetes type 1 or autoimmune conditions like systemic lupus or rheumatoid arthritis or even psoriasis. What about cancer treatment? In this study, reported intravenous infusion regimen was a mixture of DMSO and sodium bicarb, it's soda. Dosage 500 ml of 40% DMSO infused intravenously. Frequency was once daily for 7 consecutive days, followed by a 7-day break. And it was repeated in cycles. 1 week they do infusions, 1 week they don't. And these were patients with very advanced, very resistant cancers of bile ducts. And the study reported the reductions in pain and jaundice, yellowness of skin, and improved quality of life in these very advanced staged patients. There are some critical safety issues with that, because we know that the concentrations above 30%, if they are infused intravenously, carry a significant risk of blood hemolysis, meaning the rupture of red blood cells due to high osmotic pressure. And the 40% concentration used in this trial was the upper limit of what is often considered to be tolerable. And this is of course quite a high risk protocol, requiring very careful medical supervision and monitoring for hemolysis. Also renal function and other side effects like nausea. And of course these IV DMSO protocols nowadays are still highly experimental and not still standardized, and must be only done in clinical trials, in clinical research centers. And also, I told you that DMSO is considered to be a differentiation induction agent in cancer therapy. What it means that all our cells are differentiated, meaning they have their own structure, function, they are highly beneficial for our body, they do what they have to do. But cancer cells, they become de-differentiated, meaning they become more like evolutionary primitive, and they stop doing functions, and they stop obeying our central mechanisms of body regulation. And we want to make these cancer cells more differentiated, so they are not as aggressive and they look more like normal human cells. And one more direction of research in oncology nowadays is differentiation therapy. And we try to make this cancer differentiated cancer cells that are immature, rapidly dividing, non-specialized, unlike our normal cells. We want them to become more specialized. So we try to use the drugs to re-educate these cancer cells, forcing them to mature into harmless cells that will stop dividing. The classic example, of course, is all-trans retinoic acid in acute leukemia treatment that can help to cure this leukemia. You see here the picture where there is a difference between normal cells that are beautiful and good structure and ugly cancer cells. So In this review of 2023, they compile the decades of lab research showing DMSO as a potent differentiation inducer. For example, DMSO forces leukemic cells to mature into normally looking neutrophil-like cells, causing them to lose their ability to proliferate, to grow, and to divide, stopping growth of this tumor. It works by upregulating tumor suppressor genes in these cells. What about that was leukemia, right? What about solid tumors, cancers, for example, sarcomas? Studies show that it can induce the differentiation markers in lung cancer, in ovarian, prostate, liver cancers, in sarcomas. So DMSO is a potentially good and inexpensive adjuvant to sensitize cancer cells to other treatments and to help to slow down their growth, and potentially making them more vulnerable to our chemotherapy or radiation therapy or immune therapy. And of course, I told you already about the cystitis, that it is approved for treatment of this interstitial cystitis or painful bladder syndrome. The formulation is 50% DMSO solution in water. It's called RIMSO 50. It's injected into the bladder through catheter. Usually 50 ml is instilled into the bladder for 15 to 30 minutes before the patient voids. And treatment is usually done every 1 to 2 weeks for 2 months. And sometimes some maintenance therapy is needed. So, what about the safety and critical caveats? This is not a recommendation for self-treatment. Purity is non-negotiable. Only pharmaceutical grade DMSO is safe, and industrial grade can be dangerous and toxic. What about side effects? Usually it can be a garlic smell, skin irritation in high concentrations, and at high concentrations, if injected into vein, it can cause red blood cell rupture. Of course, there is a generic compound problem, meaning that DMSO is old and cheap and non-patentable. That means that that creates a major financial disincentive because for large companies, pharmaceutical companies, to fund the large-scale clinical trials needed to prove its efficacy as a primary adjuvant for cancer treatment. That's why nowadays it's not in the protocols, and what is proven in humans, again, that it's a delivery vehicle for drugs. It has compelling preclinical data that it's an immune modulator and can be a part of differentiation therapy. But still, we need big trials to prove its efficacy in cancer treatment, and of course understand the exact doses and in which cancers it's more effective. And few words about side effects. First of all, it's a garlic-like mouth taste, and there were some clinical trial on IBD treatment. This is inflammatory bowel disease, Crohn's disease, ulcerative colitis. They used oral DMSO formulation, meaning taken by mouth, containing 500 milligrams of DMSO. And they took it 4 times a day, and it decreased the relapse rate of these diseases, of these conditions. And also I want to underline, there are some unofficial oncology protocols found in internet that recommend taking it orally. They say put 4 drops of farm purity DMSO into water and drink it, rising up to 10 drops as tolerated. I mean, by one intake, 10 drops in the water, right? 40 drops per day. But it can cause allergies, it can cause stomach irritation and discomfort in some people. And again, it can't be recommended nowadays because there were no clinical trials researching oral DMSO for cancer management. That's why officially we cannot recommend it as oncologists. Thanks for watching and see you in the next videos. And thanks for supporting this channel. My name is Dr. Igor Atabekov. If you like this video, subscribe, and I will see you in the next series. Have a good day and goodbye.
Don't be afraid.